Out here, on the edge of civilization, where steel meets bone and every second counts, you are the first line of defense against the Grim Reaper. You are the combat medic, the guardian angel in camouflage, and your mission is clear. Keep our warriors in the fight. We've all heard the saying, a stitch in time saves 9. Well, out here it's not just stitches, it's lives. Proper wound care in those crucial first 60 minutes, the golden hour, can be the difference between a full recovery and a life forever altered. Remember, your battlefield isn't some sterile operating room. It's a chaotic symphony of dust, sweat, and danger. And in this environment, even a minor wound can turn deadly if not treated correctly and quickly. So, gear up medics, because in the next few sections, we're diving deep into the trenches of tactical wound care. We'll cover everything from assessing the damage to dressing the wound like a pro. This ain't no walk in the park. It's a crash course in battlefield survival. All right, Dozer Squad, the alarms just went off, and you're called to respond to the scene. Your first mission, figure out what you're dealing with. Wounds are like enemy combatants. Each one is unique and demands a tailored approach. First up, we've got the open door policy wounds, abrasions, lacerations, punctures, and the always exciting gunshot wounds. These bad boys expose the delicate tissues underneath to the elements, making them prime targets for infection. Then, there are the sneaky ones, closed wounds like contusions and hematomas. They might not look as dramatic, but don't let them fool you. Internal bleeding can be a silent killer. Finally, we've got the bone-jarring fractures, open or closed. They scream for immobilization and pain management. Remember, medics, a quick and accurate assessment is crucial. It's like reading the battlefield before launching an attack. Know your enemy, understand the wound, and you're already one step ahead in this high-stakes game of survival. In the heart of battle, your medical kit is your arsenal. Your tools as vital as any weapon. Forget fancy gadgets. We're talking battlefield essentials here. First off, gloves. You're not shaking hands with the enemy. You're preventing cross-contamination. Next, saline solution. It's like a battlefield shower for wounds, washing away grit and grime. Don't forget your trusty gauze pads. They're like absorbent shields, soaking up blood and providing a clean slate. And for those stubborn bleeders, hemostatic agents are your best friend. They're like clotting accelerators, putting the brakes on hemorrhaging. Antibiotic ointment is your first line of defense against infection, while adhesive bandages and surgical tape are the duct tape of wound care, holding everything together. And let's not forget the pain meds. Pain is a distraction you can't afford in the heat of battle. A little pain relief can make a world of difference. Remember, medics, your gear is only as good as your ability to use it. So, train like you fight, and when the time comes, you'll be ready to patch up your buddies and send them back into the fray. You've assessed the situation, your gear is ready. Now comes the messy part, cleaning the wound. Remember that scene in Platoon? Yeah, it's nothing like that. We're not going for an Oscar here. We're going for clean and efficient. First things first, irrigate. Think of it as power washing the wound. Use that saline solution generously to flush away dirt, debris, and any unwelcome visitors in the form of bacteria. Next, it's time to play detective. Inspect the wound carefully for any foreign objects. We're talking shrapnel, glass, even pieces of uniform. Remember, a clean wound is a happy wound, and a happy wound is a healing wound. Now, I know what you're thinking. This all sounds too basic. What about the tough stuff? Well, sometimes you gotta get your hands dirty. Literally. If there's stubborn debris, use those forceps with surgical precision and ensure bleeding does not continue. Remember, This is a delicate dance between speed and thoroughness. You're working against the clock, but a rushed job can lead to complications down the line. So, channel your inner surgeon, be meticulous, and clean that wound like your life depends on it. Because in the field, it just might. Now we have dress for success. Choosing the right wound, cover for the job. All right, medics, you've cleaned the wound like a pro. Now it's time to dress our wounded warrior. But instead of dressing them in Gucci and Prada, we're talking gauze, bandages, and dressings. For minor scrapes and abrasions, a simple adhesive bandage will do the trick. Think of it as a band-aid for the battlefield. But for larger wounds, we need to bring in the big guns. Gauze pads are your go-to for covering and absorbing. They're like little absorbent sponges, soaking up blood and protecting the wound. Now, if you're dealing with a deep wound or heavy bleeding, you need to call in the reinforcements, hemostatic dressings. These bad boys are impregnated with clotting agents that can stop bleeding fast. And for those wounds that just won't quit, there's always the trusty pressure dressing. Apply firm, even pressure to help control bleeding. Remember, medics, choosing the right dressing is like picking the right tool for the job. Assess the wound, consider the situation, and make the call. Next is bandaging. 101. Mastering the art of securing dressings. You've cleaned the wound, applied the perfect dressing, now it's time to secure that bad boy in place. This ain't no beauty pageant. We're going for function over fashion. First things first, make sure the dressing covers the entire wound. We don't want any peekaboos here. Next, grab that roll of gauze or medical tape and secure the dressing firmly in place. Now, here's where the art comes in. You don't want to wrap it too tight and cut off circulation, but it needs to be secure enough to withstand the rigors of vigorous transport. Think of it as finding the sweet spot between a firm handshake and a bear hug. And here's a pro tip. Use a spiral wrap for limbs and an X or figure 8 pattern for joints. This allows for movement while keeping the dressing snug. Remember, a well-applied bandage should be a thing of beauty. It's a testament to your skill and dedication, and it just might save a life. Now, on to beyond the bandage. Monitoring and adapting wound care. You've patched up your battle buddy, but your job's not over yet. Wound care is an ongoing mission, not a one-and-done deal. Keep a watchful eye on that wound. Look for signs of infection, redness, swelling, pus, or warmth. If you see any of these red flags, it's time to reevaluate and adjust your treatment plan. Remember, pain is information. Don't dismiss your patient's discomfort. It could be a sign that something's not right. And don't be afraid to improvise. Outside the wire, you're not always going to have the perfect supplies. Get creative, use what you have, and remember, a little ingenuity can go a long way. Wound care is a dynamic process. Be prepared to adapt, overcome, and always put your patient's well-being first. Next up is answer the call. Become a wound care warrior. And there you have it. Medics, a crash course in battlefield wound care. We've covered everything from assessing the damage to monitoring for infection. But this is just the tip of the spear. Your journey doesn't end here. Embrace the challenge. Become a student of wound care. Devour knowledge like it's your MRE. Practice your skills until they become second nature. Because out there, when the bullets are flying and lives hang in the balance, you are the difference maker. You are the guardian of life, the shield against the darkness. So, answer the call, medics. Step into the arena. Become a wound care warrior. Your brothers and sisters in arms are counting on you. And, hey, if you want to take your wound care game to the next level, check out our free new medic gear guide. It's loaded with 10 essential gear recommendations that will aid you on and off the battlefield. Stay safe, stay prepared, and stay tactical. Subscribe to Dozer Rescue for more epic content.